All right, and we are back with the Becoming Young podcast and a very, very special guest today.
So we're here today with Dr. Sogol, who is a functional medicine concierge doctor and practices nationwide. And would you give us a little background about what you've been doing and how you help your patients with functional medicine?
Absolutely. So yes, I am a functional medicine doctor and the longevity director for ConciergeMD, which is a nationwide functional medicine and longevity practice. So how I help my patients is using a lot of data. So using a lot of science-backed data, a lot of lab testing, and then integrating that with natural therapies and modern therapies like peptides, NAD, all of those things all together. That's amazing.
So tell me a little bit about how you made that transition, because functional medicine is not sort of at the top of a lot of people's lists. So what got you excited about that, and how did you kind of choose that as your path?
Great question. So when I was younger and I was actually applying to normal medical school, I kind of got sick myself. I was like losing all this weight. I started going to all these doctors in Beverly Hills and no one could diagnose me. They were like, you're fine. And I was like 80 pounds. Like I was really, I was like teeny. You know, everything was hurting me. I couldn't eat. And, you know, I kind of gave up. You know, I was really upset that like I was feeling so dismissed. And my mom started taking me to these like other natural doctors, naturopathic doctors, acupuncturists. And I was like, whoa, like I started getting better. And I was like, well, if this is what primary care is like, I don't want to be doing this. And I found naturopathic medicine, which is how I was trained, which is integrative. And it's basically the same term as functional medicine, like the old kind of term for it. And so I decided to pivot and study that instead. And I'm so happy because I got to study all the Western medicine and the Eastern, and then now I get to blend it together. So if I need to prescribe a medication, I can, right? But most of the time I have so many other tools in my toolbox to use for patients.
That's amazing. So I'd love to dig a little bit more into your personal story. What was kind of the thing that allowed you to start seeing results in more integrative medicine and really made a difference for you?
I think finding the root cause, first off, really like, you know, going to all these different doctors, everyone had something else, even some of the functional doctors, you know, everyone had their own thing to say, but really finding the root cause, which for me was mold toxicity. Just knowing what you have makes such a big difference. And I see that with my patients, you know, just them seeing a lab report and seeing like, oh, it's not in my head. I'm not crazy. Like my symptoms are real was probably like the biggest game changer for me.
And such a validation, which patients need that when they're really suffering, but it doesn't seem like on paper there's anything that is diagnosable yet.
Exactly. So when you unfortunately like go to just traditional medical doctors, again, there's a time and a place for that. You know, I'm not going to be your surgeon, but for primary care, their labs are very limited. And it makes you know, all the patients come to me like, well, all my labs are normal. And then I test them and I'm like, look at all your labs. They're definitely not normal. There's a lot going on. You know, there's heavy metals, there's mold, there's, you know, hormonal imbalances.
So there's a difference between, we talk about this a lot, I do with my clients, right, when I'm coaching. There's a difference between what's normal and what's optimal. So how do you determine for clients, and how do you use an individualized approach to determine what is optimal?
Yeah, so exactly. So my lab ranges, and most functional medicine doctors' lab ranges are a lot stricter, right? So traditionally, a lab range, for instance, vitamin D could be like 30 to 100. So you could be at 35 and your doctor might say, you're normal. I'm looking for optimal, right? So even on the lab report my patient gets, it has like, you know, red, yellow, kind of green, and it, you know, we want them in that green optimal range, which for vitamin D is 60 to 80. And we have those strict ranges for everything from thyroid markers, estrogen, progesterone, testosterone, IGF-1, literally for everything. So again, if you're, you know, I always tell my patients, I'm like, did you even look at this range? You know, like, did you notice that you're just, you know, you're 31 or something? And then once they look, they're like, oh, wow, yeah, that's not normal. And I've noticed this trend now, patients are starting to look now. They're starting to really question their doctors and look, and like, they feel very dismissed. And that's why I see a lot of people coming to me.
So do you feel that you're able to offer outcomes to your patient that are far above and beyond? I mean, I sort of know the answer to this question, right? But I'm asking because I want to hear it from you. But how are you able to see outcomes for your patients that are above and beyond what you would get with, you know, traditional medicine?
Absolutely. I always like to say, like, there isn't anything that we can't help. You know, so when patients are told no, that's already right there, like what the difference is, right? An complex autoimmune disease. So I treat that using herbal medicine, supplements, peptides. I think using peptides and like more of these innovative therapies right now is how I see a much bigger difference and faster, right? You get people feeling better faster, and that motivates them to want to keep going and keep getting better. I think that's one of the biggest things, is just integrating all the therapies together and also finding a unique way for each patient. Some patients don't want peptides, right? Some patients just want to do it through diet and herbs and lifestyle and nutrients. Okay, so we meet them where they're at. And that's probably one of the biggest ways I see differences, but also just listening to your patient. You have to get to know them. It's this, as many labs as I do, that doesn't matter, because if it's not matching their symptoms, then I have to listen to that, right? I have to listen to their symptoms. And that's another way I see a difference, is just getting to spend an hour with my patients versus, I think the average is like 6 minutes. Unfortunately, you can't do much in 6 minutes. So in an hour, I understand their whole life story, and I can put together the pieces of the puzzle and understand what they're dealing with, and then I really know how to help them. And then another way is just thinking about the future. Looking at genetic testing is a big one. So I look at genetic blueprints and understand what they're predisposed to, and that's also how we can determine, what are they going to be at risk for. Doing, for instance, autoimmune panels on patients very early on, we catch things much earlier before it's a full-blown disease. And yeah, I can still help them, but this is much easier.
Yeah. So tell us a little bit more about the process. Once you've spent this time with the patient, how do you really identify, what treatments are going to work the best based on your knowledge and expertise? What are the things that you kind of go to that tend to be your top choices? And how does a patient kind of give you better information so you can better identify those things?
I think letting them speak, just letting them tell their story is very powerful, and then I have to provoke them a little bit and ask a lot of questions, and like, oh, I didn't even think about that. Sometimes you ask them their past medical history and they forget to say they had a major surgery or something. I think some of the top therapies, it's really the blend. So my treatment plans always have diet. So it's a very specific diet for that patient based on their biomarkers and also what they're willing to do in their lifestyle. Some sort of exercise prescription. Usually there's peptides and IV therapy in there. If they don't, want to do peptides, fine. I'll at least give most people IV therapy. And I like to make custom formulations based on what they're dealing with. That's another key too, is, again, you could go to an IV lounge, but you're not getting much. It'll help, but you're not getting something that's very specific to you.
Right, that's just kind of like here's a menu, you can pick and choose, but it's not used with an integrative medical advisory where you're getting what you actually need based on panels.
Exactly, and I'm saying, hey, this patient's really depleted, I'm gonna add a lot more vitamin C, a lot more, glutathione for them, or they have a lot of toxic load. That's a big difference. And then, just being really specific. Like, I think targeted nutraceuticals are the biggest thing, because people take a supplement and it's not working for them. Number one, the biggest reason is the quality, and number two is the dosage. It's not at a therapeutic dosage. So actually giving them something that's targeted, and the research has shown that at this dose, this is gonna help your thyroid, or at this dose, it's gonna help your sleep. That's probably one of the biggest things.
Okay.
I think the idea of medicine 3.0, right? And this idea of personalized medicine is so important. And I don't know about you, I've noticed that there is a change, right, in the patient population. I've felt that change in my coaching clients, in the groups that I'm a part of people really embracing this idea that we are individual, that we can have prescriptive therapies and things that are individualized for your biology and my biology. But I want to take a little bit of an off ramp for a second. So I am a huge peptide fan. I've had great success personally. What have you seen, right, as possible? I know this is a large question, but for the average patient who's coming in, what are you looking to peptides to help treat?
Great question. There's a peptide for just about everything.
There is, yes.
I like to use them very therapeutically. So people with chronic illness, I love to use peptides. I see people with like multiple autoimmune diseases start using, for instance, thymosin alpha-1. And one of my patients, she wasn't even able to walk around the block. Now she can walk miles.
That's amazing.
Yeah, like that was a really big deal. I use it in that way. I use it for, I think, right, a lot of men who want to take growth hormone. I'm like, you don't need to take growth hormone. Let's give you a peptide that's just gonna tell your body to naturally make more growth hormone rather than shut off your body's production.
Right.
A lot of injury recovery. I stack different peptides like GHKCU, TB4, BPC for injury recovery, and you can almost, you can even prevent surgery for some people.
So that's called the Wolverine protocol for anybody who's listening. But I personally had great experience with that. Massive tricep tear, thought I was going to have whatever, and basically took me back to 100% in the matter of like 6 to 8 weeks. So the stuff really does work.
It works. I use it myself. Like I had a car accident, so I've used it for injuries. I use it for like, I work really hard. If I'm run down, I'll make sure to like, be using mitochondrial peptides, because our mitochondria, like, if they're depleted, then it's like our battery source almost, right? So I'll use it for that. Even like, Ozempic, those are technically peptides too. So it's kind of for everything.
So question for you on, I don't want to like overtake this whole conversation, but I'm just curious. So I know that there is, there's a weight loss component to Ozempic and some of those GLP-1 and 2s, right? But what are you seeing as far as use for preventative and some of those like microdosing? Because I know that there are a lot of folks who are taking that for longevity and health span benefits. What are you feeling on that?
100%. So at first I was very weary. Now just seeing the therapeutic benefit, like using low dose trizepatide for especially women, I've seen it be a game changer for their hormones, endometriosis, PCOS, like even just people that are stuck in a really tough cortisol kind of place, like someone like me who maybe works really hard, they're stressed, their cortisol is high, just using a little bit of that can help balance out their cortisol and insulin together. And my only thing with that is you need to be working on the root cause. If you're just using it to use it, then you're never gonna fix anything. But if they're working, that's what I make patients promise me, because if they won't, then I won't prescribe it to them, right? I make them, we have to be working on the root cause simultaneously. So if it's a cortisol issue, we have to be working on, bringing down the cortisol also in other ways. And if it's PCOS, then we're also working on balancing their hormones in other ways. And also using it in a low dose, you don't have to really go higher, which is nice. So you don't get the side effects, you kind of get these really nice anti-inflammatory benefits. So I've become a really big fan of them, actually.
That's fascinating. So question, let's veer back to what we were talking about before, because I know that a lot of people, and in fact, there are some folks here this weekend who are talking about AI. AI is the big boy in the room, right?
It is.
Or the big girl in the room. So what do you see as far as in the future with AI and bringing this data together and making you a more effective practitioner? Are you excited about this? How do you see onboarding this kind of tool?
I have mixed feelings. I'm excited because I think it can do a lot for us, and I think it's making this medicine a lot more accessible for people, right? You can take your labs, put it in ChatGPT. A lot of the labs now also have an AI component where they're telling you, based on your lab, what you should be eating and what supplements to take. I think it's good to give you direction. I don't think it's the end all be all, because I've done that. I've compared it for patients. The AI tool is not talking to the patient. It doesn't know the patient's symptoms. It can, it can gather a lot based on the lab, but it does not know who that patient is, and it's not gonna meet the patient where they're at. Sometimes I see the results and it says take 12 different supplements and do all these diet changes, and like patients get very overwhelmed. And they come to me after going to some of these, lab tools that do that for them. And they're like, I don't know what to do with this because it's so overwhelming for them. And it doesn't make sense, and they don't know if it's safe. And, so I think they don't know what medications the patient is on. So I think we're going in the right direction, but I don't think you can replace, your doctor sitting there talking to you, like touching your patient, or just even feeling, where their energy is at, where their emotions are at, what they're, what they're even capable of doing. Sometimes people are so depleted, whether they're sick or not, just even from life and stress, that like you have to take things slow with them. Other patients, they're very ready to go. They can handle, a very long treatment plan.
So if someone who's watching or listening to this is interested in sort of beginning to make that change from their regular GP, who might be a great person, right, and a great practitioner, but this is the future of medicine, right? I mean, I think the three of, at least if no one else, the three of us can agree that this is sort of where things are going.
Yes, absolutely.
How would you suggest someone take that first step? What kind of questions should they be asking themselves and their practitioner to be able to begin to move to a medicine 3.0 personalization for themselves?
Yeah, I would say, they should be asking themselves, how am I feeling today, right? Am I just okay, or am I feeling amazing? Kind of starting to rate just how they feel and envision where they're going at this rate, right? Because some people just feel fine, but in the next 5 years, that feeling of fine might, be not feeling well at all. And for their doctors, they should be asking the questions, are these optimal ranges? Which their doctors might not know though. But if your doctor's not asking about your diet, your lifestyle, exercise, your emotions, that's where I would really say, like, what is your doctor actually doing for you? Start to question like what your doctors are doing for you, because they should be doing a lot more than just prescribing a medication or saying your labs are normal. And also if they're not looking at you as a whole person, right? If a doctor is telling you that like your thyroid is not connected to your weight gain or to your autoimmune disease, or you don't need to do, you just need to do one lab marker, then that's when it starts, time to start shifting.
And that's a big red flag if your doctor's not taking those into the holistic practice. So one of the things we like to do, and it sounds like you've used a lot of these and you look amazing, we like to ask, okay, how old are you and how old do you feel? And then what's kind of the protocol that you're using in your everyday life to create this for yourself?
So I'm 31. I do have to say I do feel 21.
Yeah.
And I felt that way for a while, even before I started using peptides. I think just because I was taking care of myself in general. Even just eating the right foods, like eating an anti-inflammatory diet can do a lot. My stack right now, so definitely eating an anti-inflammatory diet. I love to do contrast therapy every morning, just in the shower. I don't have a cold plunge at home. I just do contrast therapy in the shower.
So you're turning your shower hot, then cold, then hot. And do you have like a start with hot, end with cold type
You always
thing?
want to end on cold. You always need to end. That's how to do it, because it'll seal that heat in. Always want to end on cold. So I think that's like very free, easy medicine. I like to do peptides, so I am using that injury stack right now. Still recovering from a car accident. And then I do Niagen NR IVs a lot. So the NR absorbs better than NAD, and I need my mitochondria working really well, like that battery source, NAD. And then supplements, I always take liver supported binders. I'm really big on toxins, and we're bombarded by toxins in America, no matter where we go, no matter how hard I try. I'm just, that's something that's really big for me. So every night I take milk thistle, and I take a very gentle binder to just help whatever I'm exposed to. I think that's it. Oh, and adrenal support. Adrenal support for anyone who works really hard and just doing a lot is really important. So adaptogenic herbs like ashwagandha, rhodiola.
So quick question on that before we stop. So I know there's a huge subculture about not being on things like ashwagandha for a long time. I'm not taking a position on this. I'm just curious what your feeling is.
Yeah, I haven't seen enough research about it. So certain herbs we know, like astragalus, you don't want to be on for a long time. Ashwagandha, from what I learned in school, that wasn't one of them. It's one of the most gentle herbs. However, just thinking about it, it's kind of like if you think about peptides cycling on and off, I think it's a good idea to cycle on and off of things. I do kind of change up my supplements and my adrenal support. Probiotics, you don't want to be on the same one forever. You always need to change up the strains because your body will adapt to it. So I think there is some validation to it.
This is great. We need to have you back because
I
feel like there's a lot more to talk about, but thank you for joining us today.
Yeah, thank you for having me.
Thank you so much. It's been a pleasure.
Cool.
All right, and if you have not yet been to Biohackers World, guess what? We're coming to Chicago in July and Miami in November. You absolutely want to be there. These events are unlike anything else, and I've never even seen a longevity and health optimization conference in Chicago. So I'm so excited to see all of you in Chicago at Biohackers World.